Breathing problems are often the first, but unfortunately, far too often overlooked, warning sign of an impending heart attack. Many people, especially seniors, over the age of 60, do not take mild shortness of breath or breathlessness when climbing stairs or performing everyday activities seriously. They attribute these symptoms to age or lack of fitness. But this is precisely where the danger lies. The heart is sending silent cries for help that we too often ignore. Imagine your heart working like a pump that pumps blood through a complex vascular system, like an orchestra that has to be perfectly coordinated. When the blood supply is disrupted, the body reacts with shortness of breath because the oxygen supply is no longer sufficient. The insidious thing about this is that these breathing problems creep up slowly and often only occur during exertion. A study by the German Heart Foundation found that over 60% of those affected ignored breathing difficulties before suffering a heart attack. But that's not all. Nocturnal shortness of breath, the sudden awakening with difficulty breathing, is dismissed by many as a consequence of asthma or allergies. However, it can be a serious warning sign of heart failure. Scientists at the Mayo Clinic explain that when the heart is weakened, fluid enters the lungs, making breathing difficult, especially when lying down. How should you respond? Do you know how to recognize these warning signs early on? In this video, you will learn about the 3 most important breathing problems that are often overlooked, but can be life-saving. Stay tuned until the end, because we will explain when immediate action is necessary and how you can protect yourself. If you would like to learn more about life-saving health tips for seniors, subscribe to our channel Claire Vital and become part of our growing community. Let us know in the comments if you or someone you know has ever experienced breathing problems as a first warning sign. The next chapter is about shortness of breath during exercise, why it often means more than you think. Shortness of breath during exercise is a familiar feeling for many seniors, often dismissed as a normal part of age, but this seemingly harmless breathlessness can be an early sign of serious heart problems. If you suddenly become short of breath when climbing stairs, walking, or even doing light housework, you should not ignore it. Your heart works as your body's engine, pumping blood and supplying all your organs with oxygen. When the blood supply is insufficient, your body responds with restricted breathing. Your muscles, especially your heart, need sufficient oxygen to function properly. If this is lacking, your breathing becomes faster and shallower, a warning sign that should not be ignored. A study by Harvard Medical School showed that shortness of breath during exercise is one of the most common symptoms that precedes a heart attack. This is often caused by narrowed or blocked coronary arteries, which restrict the oxygen supply to the heart. The result is a lack of oxygen in the heart muscle, which is perceived as chest tightness, fatigue, and shortness of breath. However, many seniors hesitate to seek medical advice because they dismiss these symptoms as age-related or a result of poor fitness. The insidious thing about this is that the symptoms often appear late or irregularly, which increases the risk of a late diagnosis. What can you do if you notice shortness of breath during exercise? First of all, it is important to take the symptoms seriously and not just wait and see. A doctor can determine whether you have heart disease through simple tests such as an ECG, stress test, or blood analysis. Early detection saves lives. In addition to medical clarification, you can promote your cardiovascular health yourself through regular, appropriate exercise. Even moderate walking or gentle cycling strengthens the heart and improves endurance. A balanced diet, rich in vegetables, fruit, and healthy fats, also supports your heart. Avoid smoking and excessive alcohol consumption, as these further damage the coronary artery. Stress reduction and adequate sleep are also important factors that can strengthen your heart and reduce shortness of breath. Claire Vital would like to encourage you to pay attention to your body's signals and not ignore shortness of breath. Your heart will thank you for it. Have you already experienced shortness of breath? Feel free to share your story in the comments. This will help us create a supportive community. In the next chapter, you will learn why nighttime shortness of breath is an underestimated risk for your heart. Nocturnal shortness of breath, the underestimated risk your heart is sending you. Many seniors are familiar with the feeling. You wake up suddenly at night, breathing is difficult, your chest tightens. This phenomenon is often dismissed as harmless, perhaps stress, a cold, or a consequence of aging. However, nocturnal shortness of breath can be an important warning sign of serious heart disease. When the heart is no longer able to pump enough blood, fluid accumulates in the lungs. This condition, known as pulmonary congestion, causes the airways to become blocked and makes it difficult to breathe, especially when lying down. The result is sudden attacks of breathlessness that can wake you from sleep and cause panic. The Mayo Clinic describes these symptoms as a common sign of heart failure, a condition that is particularly common in older people. If left untreated, it can lead to life-threatening conditions. It is therefore crucial not to ignore such nighttime symptoms. But why does shortness of breath occur at night? When lying down, fluid in the lungs is distributed differently than during the day. The heart has to work against gravity, which increases the strain. In addition, breathing slows down when falling asleep, making the discomfort particularly noticeable. Many seniors try to alleviate the symptoms by elevating their upper body or using several pillows. This can help, but it is no substitute for medical clarification. A heart specialist can determine the cause through ultrasound, blood tests, and lung function tests, and initiate appropriate therapy. In addition to medical treatment, lifestyle changes also play an important role. These include reducing salt in the diet to minimize fluid retention, and regular exercise to strengthen the heart. Avoiding excess weight also relieves the heart and improves breathing. Claire Vital would like to encourage you to pay attention to your well-being at night. Nighttime shortness of breath is not an inevitable part of aging, but a signal that your body is sending you. Seek medical advice early to prevent serious consequences. If you have any experiences or questions on this topic, please share them in the comments. Your input will help other seniors stay alert and seek help in good time. In the next chapter, we will discuss how irregular breathing and cardiac arrhythmia are related, and what you should be aware of. Irregular breathing and cardiac arrhythmia, a dangerous combination for many seniors. Irregular heartbeats, or sudden pauses in breathing, are a frightening experience that they often take lightly. However, the interaction between irregular breathing and cardiac arrhythmia can be a crucial warning sign of impending heart problems. In this chapter, you will learn why these symptoms should be taken seriously and how they are related. Cardiac arrhythmias, medically known as arrhythmias, occur when the heart's electrical system is not working properly. The heart then beats too fast, too slow, or irregularly. These disturbances impair the heart's pumping ability and can lead to oxygen deprivation in the organ. Breathing difficulties are often a consequence. Atrial fibrillation, a common form of arrhythmia in older people, is particularly problematic. It causes the atria to beat in an uncoordinated manner, which increases the risk of blood clots and stroke. At the same time, many sufferers complain of shortness of breath and sudden exhaustion. Scientists at Harvard Medical School have found that irregular breathing in combination with cardiac arrhythmia exacerbates the symptoms. Sleep apnea, which causes breathing to stop during the night, is one example of this. The resulting oxygen deficiency puts additional strain on the heart and increases the likelihood of heart attacks and heart failure. But how can you recognize these warning signs? Irregular breathing is characterized by pauses in breathing, wheezing, or the feeling of not being able to breathe properly. Cardiac arrhythmia manifests itself in rapid heartbeat, dizziness, or the feeling that the heart is skipping a beat or stumbling. If these symptoms occur together, you should seek medical advice immediately. Your doctor can use ECGs, long-term measurements, and ultrasound examinations to determine whether you have cardiac arrhythmia and how serious it is. Medication or a pacemaker can often help to restore the heart to a regular rhythm. Claire Vital advises, do not ignore such symptoms. The heart and lungs work together like an orchestra. A disruption in the rhythm can have fatal consequences. Prevention and timely treatment are key to maintaining your quality of life. Please let us know in the comments if you or your loved ones have experienced heart rhythm disturbances and breathing problems. Your stories can encourage others. In the next chapter, we will discuss why these symptoms are so often overlooked and how you can protect yourself from them. Why these symptoms are so often overlooked, psychology, and everyday life. Breathing problems and heart symptoms are among the most common warning signs of serious heart problems, but many seniors overlook or ignore them. This behavior is not a coincidence, but has deep-rooted psychological and everyday causes. In this chapter, you will learn why the warning signs often go unnoticed and how you can learn to listen to your body better. First, many people tend to dismiss mild symptoms as a normal part of aging. Statements such as, "That's just my age," or "I'm not as fit as I used to be," mean that symptoms, such as shortness of breath, fatigue, or a racing heart are not taken seriously. This so-called normalization often prevents early diagnosis. Another reason is the fear of a serious diagnosis. The idea of suffering from heart disease leads many people to repress and avoid the issue. They hope that the symptoms will disappear on their own, or only seek medical help at a late stage when the symptoms are already advanced. Everyday stress and lack of time also play a role. Seniors who care for family members or want to remain active push their own symptoms aside in order to function. Unfortunately, this causes important signals to be lost. Last but not least, a lack of knowledge plays a major role. Many people are unaware of the warning signs of a heart attack, or do not associate breathing problems with the heart. Misinformation or myths from those around them lead to misjudgments. Claire Vital would like to encourage you, be attentive and honest with yourself. Learn to notice small changes and take them seriously. Your body sends you important messages that can protect you if you listen to them. Another important step is to see your doctor regularly. An open discussion about your symptoms and a thorough examination can minimize risk. Your health deserves this attention. If you have had difficulty recognizing symptoms or are struggling with anxiety, you are not alone. Share your experiences in the comments and let's find ways together to take better care of our health. In the next chapter, we dive deeper into the science and explain how heart attacks affect breathing in understandable terms and without technical jargon. The science behind it, how heart attacks affect breathing. When we talk about heart attacks, most people first think of chest pain or sudden weakness. However, the connection between heart attacks and breathing problems is often underestimated. In this chapter, we explain in simple terms how a weakened heart directly affects breathing and why you should be aware of these connections. The heart is the central pump that transports blood through the body. In a heart attack, part of the heart muscle is damaged because the blood supply is suddenly interrupted. This restricts the pumping function and causes blood to back up, especially in the lungs. This congestion leads to fluid accumulation in the lung tissue, known as pulmonary congestion. Pulmonary congestion makes it difficult to absorb oxygen. Your body reacts with shortness of breath as it tries to compensate for the lack of oxygen. This can manifest as shortness of breath during exertion or even at rest. As the fluid continues to accumulate, breathing becomes increasingly difficult, which can be life-threatening. Scientific studies, such as those conducted by the Mayo Clinic, show that around 50% of patients with heart attacks or heart failure complain of such breathing problems. The symptoms often appear before other typical signs and are therefore an early warning sign that you should take seriously. But there is hope. Modern therapies and a healthy lifestyle can improve heart function, reduce congestion, and thus make breathing easier. Medications that relieve the heart and reduce fluid accumulation are often part of the treatment. In addition to medical therapy, it is important to control risk factors such as high blood pressure, diabetes, regular exercise, a balanced diet, and avoiding smoking provide lasting support for the cardiovascular system. Claire Vital recommends that you pay attention to your breathing and do not underestimate any changes. Especially in older people, early detection of shortness of breath can be life-saving. Do you have any questions, or would you like to share your experiences? Write to us in the comments. Your stories help raise awareness and help other seniors. In the next chapter, you will learn what immediate measures you can take to protect your heart health if you experience breathing problems. Immediate measures for breathing problems. What you can do. Breathing problems, especially when related to heart problems, require quick and targeted action. In this chapter, you will learn what steps you can take immediately to relieve your symptoms and prevent more serious consequences. First, it is important to remain calm. Panic often worsens breathing and puts additional strain on the heart. Sit or lie down, with your upper body elevated if possible. This makes breathing easier as it gives the lungs more space and allows fluid to be distributed more effectively. If you are already taking medication for your heart or blood pressure, make sure you take it regularly and as prescribed. Sometimes a missed dose can worsen symptoms. Drink small sips of water to keep your body hydrated, but avoid drinking too much, as an overloaded circulatory system puts strain on the heart. If your doctor has advised you to restrict your fluid intake, follow their instructions carefully. If you suffer from shortness of breath, watch out for rapid changes. Sudden deterioration, chest pain, dizziness, or blue discoloration of the lips and fingers are serious warning signs. In such cases, do not hesitate to call the emergency service. People with known heart problems should draw up an emergency plan with their doctor. This can contain specific instructions on how to react in certain situations, such as taking nitroglycerin or calling for immediate help. In everyday life, it helps to practice gentle breathing exercises regularly. Deep, slow breaths improve oxygen uptake and strengthen the diaphragm. Clar Vital recommends simple exercises that you can do comfortably at home. Regularly checking your blood pressure and pulse at home can also help to detect changes early on. Modern measuring devices are easy to use and provide important information for you and your doctor. Don't forget the importance of exercise, adapted to your ability. Walks or light gymnastics strengthen the heart and improve lung function. However, don't overexert yourself and listen to your body. If breathing problems occur more frequently, be sure to make an appointment with your doctor or cardiologist. Early diagnosis and treatment can save lives. If you have any tips or questions about breathing exercises and emergency measures, please share them in the comments. Together, we can protect ourselves better and stay strong. In the next chapter, you will learn when you should seek medical help and which tests are important, when to see a doctor, and which diagnoses are important. Recognizing the right time to see a doctor for breathing problems can be crucial for the early treatment of serious heart disease. In this chapter, you will learn which symptoms must be taken seriously and which tests can help find the cause. If you suddenly experience severe shortness of breath that does not improve even at rest, you should seek medical help immediately. Pain or pressure in the chest, dizziness, faintness, or blue discoloration of the lips and fingers are also clear warning signs. Do not delay your visit, as these symptoms may indicate an acute heart attack or other life-threatening situation. For all other breathing problems that start gradually, such as persistent shortness of breath during exertion or nighttime breathing difficulties, it is advisable to consult your family doctor or cardiologist as soon as possible. They will ask you about your symptoms in detail and perform physical examination. The most important diagnostic procedures include an electrocardiogram, ECG, which checks your heart rhythm and blood flow, and ultrasound examinations of the heart, echocardiography, which provide information about the pumping capacity and heart valve. Stress tests are also often performed to see how your heart reacts to physical exertion. Blood tests also play an important role. They help to monitor inflammation levels, cholesterol, blood clotting, and other important parameters. Special markers, such as BNP or troponin, can provide indications of heart failure or heart attack. Sometimes further tests, such as a cardiac catheterization, are necessary to accurately identify narrowed vessels and treat them if necessary. Your doctor will advise you individually on which tests are appropriate. It is important that you describe your symptoms accurately and do not downplay them. Make a note of when and under what circumstances the shortness of breath occurs, how long it lasts, and whether other symptoms such as chest pain or swelling are present. Clar Vital emphasizes, early and comprehensive diagnosis can significantly improve your quality of life and prevent complications. Don't hesitate to seek help. If you have experience with the diagnosis of heart and respiratory problems, or have questions about examinations, please feel free to write to us in the comments. This way, we can support each other and raise awareness of these important health issues. The next chapter is about how you can protect your heart and lungs together through a healthy lifestyle. for a better quality of life in old age. Prevention through lifestyle, protecting your heart and lungs together. When it comes to preventing heart and respiratory problems, lifestyle plays a key role. It is especially important for seniors over the age of 60 to become active and strengthen their heart and lung health through targeted changes. In this chapter, you will learn how you can increase your vitality and minimize risks with simple but effective measures. Regular physical activity is an essential component. Exercise trains the cardiovascular system, improves oxygen uptake, and strengthens the respiratory muscles. It doesn't have to be a marathon. Even moderate activities such as daily walks, light cycling, or gentle gymnastics are helpful. They promote blood circulation, lower blood pressure, and reduce stress, which puts strain on the heart and lungs. Diet also has a major impact on your health. Focus on fresh, unprocessed foods that are rich in antioxidants, vitamins, and minerals. Fruit, vegetables, whole grains, nuts, and healthy fats protect against inflammation and support vascular health. Avoid excessive salt intake, too much sugar, and fatty foods, which can raise blood pressure and cholesterol levels. Smoking is one of the biggest risk factors for heart and lung disease. If you still smoke, now is the best time to quit. Passive smoking is also harmful, so you should create smoke-free environments for yourself. Getting enough sleep and managing stress are often underestimated pillars of health. Chronic stress raises blood pressure and puts strain on the heart. Relaxation techniques, such as meditation, breathing exercises, or yoga, can help calm the mind and strengthen the body. Regular checkups with your doctor are also important for detecting changes early on and taking action. Pay attention to symptoms, listen to your body, and have your heart and lung function checked. Claire Vital recommends viewing prevention as a lifelong process. Every little step counts, whether it's a walk in the park, a healthy meal, or a relaxing breathing exercise. Together, these habits create a strong foundation for your well-being and independence. Do you have your own tips or experiences with healthy living? Feel free to share them in the comments so we can motivate each other. In the last chapter, we summarize all the important findings and provide you with practical recommendations for action. Summary and practical recommendations for a better quality of life. In the previous chapters, we have seen how crucial it is to recognize and treat respiratory problems for your heart health, especially after the age of shortness of breath, breathlessness during exercise, nighttime breathing difficulties, and cardiac arrhythmia are warning signs that should not be ignored. But knowledge alone is not enough. It is important to translate this knowledge into concrete steps to improve your quality of life in the long term. First, you should learn to listen to your body. Small changes in breathing or physical performance are signs that you need to take seriously. Don't wait for dramatic symptoms to appear. Take action early by consulting your doctor. Regular checkups and open communication help minimize risks. Secondly, prevention through a healthy lifestyle is key. Regular exercise, a balanced diet, sufficient sleep, and stress reduction strengthen the heart and lungs. Avoid risk factors such as smoking or excessive alcohol consumption. Small changes, such as taking a daily walk or eating less salt, often work wonders. Thirdly, learn the immediate measures to take in case of acute breathing problems. Stay calm, raise your upper body, and call emergency services if serious symptoms occur. An emergency plan with your doctor provides security and helps you react correctly in an emergency. Fourthly, promote your health through targeted breathing exercises and the use of modern aids such as blood pressure or pulse monitors. This supports self-monitoring and helps you notice changes early on. Don't forget, you are not alone. Harness the power of community, share experiences, and motivate each other. Your story can encourage others to seek help early on. Claire Vital encourages you to implement these recommendations step by step. It's not about perfection, but about progress. Every little success strengthens your heart, improves your breathing, and gives you more joy and independence. If you enjoyed this video, please subscribe to our Claire Vital channel and write in the comments section about your experiences with breathing problems or which tips have helped you. Share this knowledge with your loved ones, because together, we can save lives. Stay alert, take action in good time, and enjoy every breath full of energy and quality of life.